Hey everybody, it's the Perfecting Peds show, and look at that. We've got a little Ped of our own. So this is my
Buddy.
little Cedar, and it's always nice to be able to meet family. And he loves
Yes.
blues.
Okay.
And
I love
today
it.
and today we're talking about some things that get inflated, and we're trying to calm down a little bit with these earaches. And Jen and I have been talking about them in different ways over the last few weeks, and gone into antibiotics and treatments or recognition. But today we were hoping to talk about a little bit around how do we avoid it, Jenna, and how do we calm down some of those symptoms, right?
Yes. You can hear my dog in the background. So this is real life.
This is live,
Um,
this is real. I
I love it. But yeah, so thank you so much, Kev. So we're going to be talking about because obviously the one component is the pain that comes with the ear infections, and really, that fluid and the bulging tympanic membranes that we see that my little guy sure is feeling. She's now 4 infections in 3 months, and it's impacting her sleep so much. So there's obviously things that you want to do to help minimize the pain. That again, if you have the ear tubes, which she goes for a consult on Friday, luckily you don't feel that pain. So some things are just our over the counter wonderful analgesics is and antipyretics is Tylenol, of course. I love Tylenol in the fact that it only comes in one concentration over the counter, which is beautiful. One of my pet peeves with a lot of the over the counter medications is that, it just says contact MD if under the age of 2. So there's no real weight-based dosing that a parent that's like, in the middle of the night going to draw up a dose for anybody under the age of 2 is like, oh, like, what am I doing? So that's something that honestly I'm trying to get changed on a national level. I bought like a psychopath a provisional patent to help put on these bottles different QR codes to help with dosing. And so I'm hoping, I know the first step was buying the patent, but I have all these ideas because, as a mom of 23 children, and when they're under 2, like, I always think, what would I have done if I wasn't a pharmacist and didn't know how to dose these things, because they always get the sickest in like the middle of the night when you have absolutely no resources, right? But again, so I love Tylenol in the way it comes in one concentration. So like, whether you're, irregardless of who's providing you the dose, whether it's the pharmacist, the nurse, or the doctor, we're all working with, when we say mLs, regardless, you can't be messed up because it comes in that 32 milligram per ml concentration. As we know, that is on back order. So there are other things that you can do. So you can, there's Tylenol chewables, which are, from feedback from my own children, they taste okay. Then we also have suppositories, which, like I said on one of the last little podcast, that I like them for under the age of 6 months, just because it's easier. And honestly, sometimes my daughters have slept through fevers, and so I've just done it, and kind of mean to do in their sleep, but it's much easier than them spinning things back at you. A pediatric pharmacist trick is that of knowledge is that actually you can dose the suppository slightly higher than you would give it orally, just based off of the absorption to get effect. So traditionally it's 15 mg per kg per dose with a max of 650. But with the rectal suppositories, you can actually go up, it says 20 mg per kg per dose. And then again, you're really at the mercy of and rounding to the nearest half a suppository, essentially, to get it for your little one. So those are 2 different dosage form options with the back order. And then the third option is just a regular tablet. You can crush it and put it in something, assuming that your kid's weight dose comes close to a half a tab or a full tab. So that's really, and you can dose that every 4 hours as you need. the reason I like Motrin like as a preferential parent preferential is just because it's every 6 hours versus every 4. But Tylenol is great. You can dose it every 4 hours, and that's one of the so one of the things we use for pain and fever. The other medication that we use is Motrin, and I do have a hard time with Motrin because it comes in 2 different concentrations, and that kills me. It's a big medication error source, and so they have infant Motrin, which is just some marketing ploy that whether you're an infant or you're an adult, or regardless of your age, you can take it. And then there's the 50 per milligram per 1.25 ml, so 40 milligram per ml. But then, so those are the infant drops, and again, that means nothing because an infant can get any Tylenol concentration. So then the other one is 100 milligrams per 20 ml, and per 5 ml, and that's 20 milligrams per ml. So the concentrated is 2 times the dose of the most frequent ibuprofen on the market, and that leads to massive medication errors for parents. Hold on, you're on mute. You're fine. I know all about having kids in the background. Believe me.
So maybe we should just do this, Jenna. You and I should just you can bring the girls on. I'll bring the boys on. I'm sure the thing is entertained by them, probably more than us. But with that,
I welcome it.
That I love is that every time I have a family member that has a sick kid, it is a text in the middle of the night, just like you said.
Oh yeah.
It fails. And the other piece is that I always have to remind them because they'll say, "Hey, Kevin, what dose of ibuprofen do I give them?" And then I always have to say, "Send me the picture of the bottle."
It's so never important. So important.
It is. And I feel like that's missed way too often with our kiddos and is a dangerous component in society. So if you have any pull out there, anybody listening, and you can get rid of these dosing strengths and we can start to bring them down, then pull that weight. Otherwise, perfect highlight, Jenna, to make sure that we are getting that picture or seeing the actual form that they're getting it in.
Yeah, because so many times the parents are like, oh, they can get they'll be like, oh, my child's like, 6 months and I only have the 100 per 5. I don't have the concentrated one. And I'm like, it's just like a whole unnecessary marketing thing. Like you don't have to have it. So, but exactly like you're saying, I literally will not answer their question in mLs until they send me the physical picture of the bottle because I'm so scared that they're going to make that error. But like I said, Motrin really, we've thought for years is really only safe for those 6 months and older. We have new literature to show that it's actually safe, especially like infrequent dosing, like one time offs, and actually 3 months and older. So the only time I would ever say do that is if you give the Tylenol, you wait an hour or two, and that child is still in excruciating pain or still having a fever, then you can do that one time off. Some of the literature says even maybe a half a dose, like 5 to 8 mg per kg. But we're finding that you can actually push the age limit down a little bit. And again, that would only be done if for some reason the Tylenol is not working and you need a secondary analgesic, and that would be under the guidance of a pharmacist or for a provider. They have chewable tabs too. They unfortunately do not have suppositories. I have actually worked with compounding pharmacies who will actually compound the Motrin suppository if it's like we cannot get this kid to take anything else. And then we have, again, the tablets that, assuming the dose comes close to a whole tab or a half a tab of that 200 milligrams, you can crush that and put it in anything. So those are some ways to get creative. And those are really the 2 medications that we're going to use for the pain and the fever, as far as just, getting that control and getting through that first 48 hours of antibiotics, assuming it's bacterial, but assuming it's bacterial, after that 48 antibiotics, usually the fluid and the pain will calm down and subside. So those are
to rotation? Are you a rotation fan? Like, is that what you do? Do you rotate the Tylenol, ibuprofen?
I
I don't.
do. That's a great question. I only do it or advocate for it for like 24 to 48 hours. And then I'm like, no, I'm like, I like to know when their fever curve's improving. So I sometimes will do like, I don't like prophylact them with antibiotic and Motrin. I'm more like, if they need it, I give it. If not, I don't. But sometimes there's cases where you can anticipate like post like tonsils and adenoids or like painful things, or like I said, if you know that there's a double otitis media and it's like bulging and your child's sleep is off and everything, there are times where you can just do around the clock, and like you're saying, you'll do something every 3 hours. So you'll do the Tylenol, 3 hours later Motrin, then the Tylenol again, then 3 hours later. So 3 hours you're doing something. And like I said, there are cases when it's like it's greatly impacting the quality of life of the kid, from an eating perspective, from a sleeping perspective. And you're just, I don't advocate to do it around the clock more than that 48 hours, because then you got to go back to the doctors.
Yeah. No, I totally hear you. I think for me, it's really the adherence element and having multiple medications out, just the likelihood of mixing those things up and not doing. So one thing I've recommended before, Jenna, is Tylenol during the day and then an ibuprofen at night, is the last sleeping through, just to avoid the, I'm going to interchange these. Which bottle did I use last time? Which dose?
It's so true, though.
But that's the only thing that I had. One thing, I know that we're running on time here, but other than like a warm compress, warm air, chewing gum, like I did as a kid, to be able to just open up the earway, give some relief. Any other things, Jenna, that you've seen like work that are even non-medication related, that you've thought at least try these things out to be able to help with, like in between that 3 hour gap of having those meds on board?
Honestly,
that's about all the ones.
Yeah, no, you got it. Like, I don't really think, I tell my daughter, like, do the funny, like, she's like, yeah, and what she like now, like when we ride on an airplane, she's like, the whole time. You look ridiculous.
Really good, honey.
But her grandfather is an Air Force veteran, and so he taught her that trick, and she is tried and true to like all the time. So yeah, so no, it's just for fact that like as a parent you need to laugh sometime. Just like maybe just that alone is enough to try that trick.
Well, that's the best. Yeah, if you can laugh, sometimes that's the best medicine, right? Well, fantastic. Next time, I know we have other things to cover inside of otitis. Jen and I will hook you guys up with what we're going to do next. Go over to the Perfecting Peds channel. Check out all the stuff that Jenna is doing there for additional content and information. And we will talk to you next week.
Thanks, guys.